Welcome to Care Culture Talks. My name is Eyal Heldenberg. I'm the CEO of No Barrier, an AI medical interpreter for healthcare providers. I have the honor to be with Diana Erani for our third episode. Diana, how are you today?
Great. Excited to be here with you.
All right, perfect. So, would love to discuss with you, Diana, on different topics on around healthcare, culture, language, and more. And if you don't mind, could you share with us a bit your fascinating journey in healthcare?
Sure. I am the Chief Operating Officer at the National Association of Community Health Centers. And the way I started out was my first job in community health was at a place called Healthcare for the Homeless Houston, which was a community health center in Houston, Texas, working with the homeless population to provide them health care. I worked there for a few years, starting as clinic manager and then going up to chief operating officer, where I learned all about the needs of the homeless population, how to care for them, how to be what we call culturally competent, meaning to treat them in a way that works best for them instead of what we think they would want, to ask them what they would want, and to be successful in making a big difference in people's lives. I then moved to Massachusetts, where I am originally from, and I joined the Massachusetts League of Community Health Centers. That is the statewide association for community health centers. It has approximately 52 community health centers across the state, serving 1 million patients, or about 1 in 7 people in Massachusetts. And I worked starting off in the health informatics division, and then I became the chief operating officer. And then just 6 months ago, I left that job to become the chief operating officer at the National Association of Community Health Centers, where I work with the 1,500 community health centers across the country that serve people in 16,000 different sites. We serve 32.5 million people, or 1 in 10 Americans.
This is amazing. It's quite a journey. It's a lot about community center health, and what initially drew you to that specific direction?
Well, I'd worked in healthcare before, but I really like the idea of the community health center. And the reason I liked it so much is community health centers are unique because 51% of the board are comprised of patients. So you really have the community driving what the health center does, and it doesn't just stop at primary care. It includes behavioral health care, dentistry, ophthalmology, and many other services, all in one stop, so that people can truly get care in their community.
Got you. And in your recent role in NAC, what excites you most about this national responsibility?
Well, what's really exciting is that community health centers make up the largest primary care group in the country, because they're all across the country, and they seek to provide the kind of health care that people can have successful outcomes, because they work to understand where the patient is at and what would be helpful. And they have higher successful clinical quality metrics than a lot of traditional medical practices, and they do it for less cost. So it's an exciting place to be, and we're looking to the future where we see a growth of community health centers. Our goal is to serve 1 in 3 instead of 1 in 10.
Got you. Maybe let's talk about the model of community health centers. Why do people seek, they address those centers instead of, going to emergency rooms or other traditional services?
Well, they're designed to set up to make people comfortable. So what we call them is culturally competent, meaning understanding the culture, so that people would say, I know if I go to the community health center, I'm going to be in a place where they welcome me. They have people that look like me. They have people that may speak my language, or if not, they're able to get access to interpretation. And they have a lot of other patients like me. And so what that does is bring people into primary care so they could be treated in a more cost-effective but also healthy way for the patient. So they don't have to wait until they're very sick and go to the ER. Instead, they feel comfortable coming into the health center and having someone work with them to manage their illnesses, give well visits to their children, and at the same time, you can get your tooth pulled.
All right. So you mentioned that those centers are by design cultural competent and support, for example, language and non-English speaking patients. Can you walk us through how those language access programs typically work across those centers and in different touch points within those centers?
Sure. So community health centers are designed for anyone who walks in the door to be treated. So it doesn't matter where you come from or what language you speak. You come into a community health center and they're going to welcome you. So the first thing that they would do is talk to the person at the front desk to say, hello, my name is so-and-so. I'd like to see a doctor. Or it could be over the phone or even now online. So if it's online and they don't speak the language, online portals are very rarely in anything other than English and Spanish, so that would be very problematic. So then you have the phone call. The phone call will go into a call center at the health center, and if they have the person available that speaks the language, she'll speak with them, but often they do not. Some health centers see patients in more than 50 different languages. So they will then turn towards an interpretive service to treat them. And similarly, if they walk into the health center, the front desk person will assess if they need an interpreter or not. And then that person has to go activate the process for looking for an interpreter.
Got you. And those medical translators are either employees or maybe from remote or iPads or iPhones, right? Something like that?
Yeah, so whenever someone has a visit, they need to have a certified medical translator. We don't like to use family members because they don't translate things accurately, and they may not communicate things as directly as needed because the doctor needs information they might not want to share in front of a family member. So we always look for a certified interpreter. If there's none available at the community health center, then they turn to a company that they would have a contract with for a language line.
Got you. All right. So I guess this is kind of something you as a provider must comply with, or you need to bring this service. Otherwise, you won't be able to communicate with the patient. You just need to do it, right?
Yeah, it's not like there's an option to turn the patient away. That's not something that anyone would do, but you're also not allowed to do it. So having it's imperative for the health centers to be able to have access to language translation.
Yeah, it makes sense. We talked with many providers and operational managers, and there are pros and cons to this, I would say, workflow, to this operation. I wonder if you can mention some of the pros and cons of using or implementing those language plans in the community centers.
Well, when they work well, it's wonderful because then the patient feels heard. They feel understood. They can ask questions about their health care. They can ask questions about a lot of things they just may not be familiar with that other people may take for granted, like, how to go to the pharmacy and get medications. But they can also be difficult because when it's not working well, the provider or the doctor will be standing there with the patient waiting for someone to come on the line. The person that comes on the line may speak the wrong dialect, and it won't be helpful because they can't translate, or they'll translate incorrectly. Sometimes you have to put the patient back in the waiting room, and it can take an hour to get someone for their language. And then, of course, how do you get that information into the medical chart? That's the other question. It can't just be voice translation. Because if you try to put that into the medical chart, there's one more barrier between the actual translation and the way it's documented.
Got you. All right, perfect. So those community centers, they serve different, I would say, specialities. We were talking with different providers, and one of the main, I would say, topics was around private conversations, more on the behavioral health. I wonder if you could have some insights on those specific sensitive conversations. Could you elaborate how a third party medical translator is involved or influences the encounter?
So having a translator again is so important here because you really don't want to use someone from the community. You really don't even want to use someone from the health center if it's a small health center because they might know the person or they might know the person's relative or friend and it's too close and people won't feel comfortable discussing things. Similarly, a lot can get lost in translation if you don't have the right translator and people may ask the wrong questions or be very shy about sharing certain personal details, but without having that knowledge that you really can't treat the patient well, and there could be something big that you're missing. So you need a really good, solid translator that can also let you know if the person is maybe they're answering a different question than you ask them. That's very common. So you have to be able to understand right away if you need to rephrase the question so that you get the information that you need to treat the patient.
Yeah, yeah. We also heard, like you mentioned, that specific in mental health, there is more, I would say, sensitive topics, could be around shame, different thoughts, sometimes around sexual or drugs or addiction or any other really sensitive topics um, where you need to discuss and you need to kind of elaborate and you need a professional assistance there and interpreter could come in as a help on that front.
Yeah, very much so, because let's say you're talking about someone who may have a substance use disorder. You need to really be able to drill down into the details and make sure that they understand the questions. So you could say, maybe you ask them, do you drink every day? And you would have to ask them more specific questions like, how much alcohol do you drink a day? That might not be the same to someone to say like, oh, how much beer do you drink a day? How much wine? How many, shots of vodka or whatever it is. So you need to have that very specific language so that you can provide the right information so it could be understood. Um, Also, even with other types of thoughts, like people that might want to hurt themselves or are thinking that they're very depressed, like that can mean different things. So you need to have precise language so that people can understand what they're dealing with.
Yeah, yeah, yeah. I wonder from your, I would say, managerial experience and operational experience, what would you recommend health centers when they consider their, language access plan strategy, how to develop it, how to optimize it, anything around that operational challenge?
With many things, especially involving doctors, you have to make sure you get it right the first time. They're really not interested in trying something and it doesn't work and you have to wait and then you have to call IT and then the patient's waiting and then their other patients are backing up. They really don't have a lot of ability to wait on technical and other glitches. Similarly, if the translation isn't very precise, they're not going to be able to understand or get the information they need. If a patient says, I have a pain, you need to be able to say, is that pain dull? Is it throbbing? Is it stabbing? How long has it been there? Is it, over here in your body or over here on your body? Does it come when you drink or exercise? Or, there's many, many questions. And if they don't have that very easily available, it makes it hard to treat the patient. So you have to have both the competency and the technical know-how to make sure that it happens smoothly. That's the number one thing. And then the number two thing is it has to flow past the doctor into the rest of the health center smoothly. They have to understand what topics were discussed so that the people that bill for insurance will understand what they can bill for and what was or wasn't covered. The people who need to make follow-up appointments in the call center will need to understand what specialists they need to find for the patients. And then the patients, communicators, a lot of them have what we call community health workers that reach out to them to check on them. How are you doing? Are you eating right? Do you have your medicine? They also need that translation to be correct, or they'll be asking them about the wrong thing.
Got you, got you. So basically, you say this is probably a mixture of training the providers, the employees themselves, to kind of be aware, be minded, and not to compromise on that. And on the vendor side, you mentioned two factors. One is fast access, like access to care, and also insist on the quality of interpretation to make sure that the vendor has um, the right workforce to make sure those messages are interpreted from English to the other language correctly. Am I right? Those are the two metrics that you mentioned?
Yes, if there's a bad translation, then you'll lose faith in the product, and that'll be the end of using that product, because it's so important to get even the smallest details right. And things are called different things in different languages. So, explaining something like lightheadedness versus dizziness, you're going to have to the interpreter will have to make sure that you have the right words for that so you get the right information.
Yeah, makes sense. Perfect. So, looking forward to the future, lots of things is going on right now with technology. I wonder what role can national organizations play towards the future? There are many healthcare challenges all over the place. I wonder, like, how do you see the national organizations' role in that?
So the national organization strives to make it as easy as possible for community health centers to treat the patients in their community. So, for example, we have big conferences, 4 of them every year, where people come together and we learn from each other. We'll say something like, let's have a session around who's using AI to use for interpretation or to scribe or whatever. And then people will come together and talk about what's important to them and what their experiences have been. So that's one example. We do that with many other things, like who has had success treating people with diabetes in an urban setting who don't have access to fresh foods. And that will be another topic where people will share together. So it's the sharing together of what is working and what is not working. And at the same time, understanding that the community health centers themselves are very different. There's a saying, if you've seen one community health center, you've seen one community health center. So it's very different. And some of them are early technology adopters and willing to try things. And if it doesn't work, try something else. Others are not interested in trying something until it's been done for a few years, and everyone in between. So that's another way that coming together nationally can share that information.
Nice. Those collective mind sharing, those forums, those events from time to time, get people together and learn from each other on different workflows and amazing. Maybe last question for this podcast. What gives you hope about the future?
Well, I have a lot of hope about the future, and I think it's because when you work with your own community to improve and to make people better, then you're definitely going to succeed. Because if each place is different, each person is different, but when we all have the same goal of making each other healthy, not just treating the sick, but preventing sickness, that's when I think that everyone working together will make a big difference. We have a
Amazing.
saying, we say stronger together.
Amazing. So, Diana Erani, was great to host you in our Care Culture Talks podcast, and appreciate it. Thank you.